Denise can begin.
You could swap, and Dennis can host.
So why don't you ask me what I see the potential?
Yeah, you can ask your. Okay, can you hear me?
Right.
You cannot hear me yet, but it's okay. I can come closer to Denise.
Yes.
Okay.
I-
You can start talking about yourself a little bit, about your experience in bringing, evangelizing people about VR in healthcare in general, and then we can split into healthcare training specifically.
Okay. So virtual reality has a tremendous potential, and I believe we were going to ask, would you raise your hand if you've already worn a headset? And if you've used this headset in a healthcare relation? So much less. So if you've already worn a headset, then you know the tremendous potential. Everybody feels that there's really a before and after in trying on the headset. I'm sure you agree. And the reason it is this is that there's just such a powerful mechanism of action that we don't understand fully, but we also don't even know how aspirin really works, if you want to get down to it. So virtual reality can tremendously improve the healthcare professionals' way of taking care of patients and their own ability to deal with the patient by being more empathetic, by having better communication, by being better trained to do certain types of procedures. And I think you wanted to know why it isn't more known. And so one could say, with all these amazing superpowers, why isn't everybody in this room regularly treated with this or seeking out specialists? And I think it's sort of negative serendipity. It's been in the wrong place at the wrong time. It took so long to get the headsets to the point where it could be commonly distributed that the other ways of dealing with medicine are just so entrenched. And I think that there's a medical and economic reasoning that's going on, which is people always saying we don't have enough proof. And it would be so disruptive of the workflow if you were to tell professionals they had to stop all other ways and just use this. So we're really at the bottom of a very steep hill. Does that answer your questions?
Yeah, it does. That's a good start. I want you to imagine something, so to get an idea of the potential of VR. If you imagine yourself going to an emergency room and you have a heart attack and you're being taken care by a junior doctor that has no hands-on prior experience, and you're one of the first patients that he's going to be taking care of, you're going to be very scared. But imagine if that doctor, during the academic years, or even after that, during the residency, he could have done this training in virtual reality with a virtual patient, training, trying and erring without having to risk anyone's life. And then after he has these skills built, not only the technical skills, but the communication skills, which is something very important for medical doctors. So then they would be able to really treat real people in a proper way, especially in conditions like in an emergency room. So that is how we can see really the benefit and the potential of VR and simulation, because it's very realistic. So we are here in a very different groups of perspectives, because we have the academic healthcare worker and professional, as a medical doctor, and also a VR developer. We have Devi coming from the industry that is building the apps, the software that we're going to be using for medical training, and Denise, who has a very strong background in healthcare technology and is a big evangelist for VR. So you started already doing your view, so I would go to Jonathan. I think yours should be working.
Can you hear me?
Yes.
Yeah, so my background is as a UK doctor, and I was fortunate enough to get a medical education post at Queen Victoria Hospital in East Grinstead to develop resources in VR and the metaverse. And it was through that process that I became an academic in extended reality, using VR as a healthcare tool for training. I wish I had it when I was a medical student. And you can see the enthusiasm with medical students that are coming through at the moment for this technology. And they really, really do get it. Like José was mentioning, if you can be prepared a little bit more for that scenario that you come across for the first time, which is quite common in those junior years as a doctor, if you've trained in VR in a safe, risk-free environment, in a simulation that enables you to perform better in the real life scenario, then you can basically have a better experience for the patient, clinician interaction when you come across it in real life. I think the students are really eager to use this technology, and it really does have advantages for all in terms of their training, but there are some adoption issues that we'll go into later.
Okay, let's go first to the benefits, and then we go through the barriers. Devi, it's up to you to tell about what you see as the benefits of VR for healthcare and medical training.
Okay, I think the benefits are many, to be honest, and I guess the first advantage, we've been in the space of immersive technology and actually blending AI into immersive tech for over 18 years. So it's not something we've been doing it in the last year or two. It's been 18 years of intense research being put into taking medical training simulations into another level. And what I mean by that, if you look at the current traditional methodologies, whether it's textbook, e-learning, or even VR learning, you start to notice that everything is fairly scripted. But my question to you all is, medical industry is not. It's great to understand the procedures and the aspects, but then you need to have that muscle memory to be able to react spontaneously across critical decisions when you're faced with life-changing situations. So this is where VR can be powerful by being able to replicate that complete immersion through audio-visual aspect and be able to help you suspend from reality. So all your senses are completely engaged with that training scenario that in front of you. And you can also use the power of AI on not just the back end to give you performance analytics, but actually take it into the front end to give a non-linear gameplay. So we can actually control the gameplay to be able to adapt to the end user, so the trainee's existing abilities, by giving contextual challenge and support. So these are some of the ways we are able to take advantage, and there are many, many more to talk about.
Okay, well, and what are the barriers and challenges to implement it in real life? Denise already talked a little bit about it. Now it's up for, let's see what's the issues coming from the academic and clinical settings.
So basically, barriers to adoption. In the UK, in the landscape that we're working in at the moment, so I'm working in an NHS hospital, you have to prove that it's cost effective or better than the alternative. So one of the really important things we are doing as academics are taking these VR applications and evaluating them and scientifically, rigorously evaluating whether they are effective or as good as or better than the alternative traditional media that people traditionally learn with. However, in the hospitals, because budgets are tight and education, maybe new headsets would be a luxury, we need to prove the efficacy that it's going to improve the ability of the students and be a cost-effective measure in their training. So adoption is a problem because what organisations don't want to do, and things that I've come across in my hospital, is they don't want to buy a load of VR headsets that become redundant within a couple of years, that can't be updated or obsolete, basically. So some people are sceptical about bringing in VR because of those reasons. So we need to have reassurance and mechanisms in place to make sure that we overcome those obstacles.
Yeah, that's very good. Important. How about from the industry? What do you see as challenges and barriers?
I guess those challenges will obviously become our challenges because we need to work in sync. And certainly cost, time, and most importantly, change managements are very, very critical aspects. when you're looking at embedding any new technology. From an industry point of view, the way how i3 Simulations is addressing this is that, as said, we managed to build this technology over 18 years of research. So research that we have proven and tested across various sectors. And I'd love to bring this over to the audience is that there have been about 3,500 some publications and research evidence out there that's confirming the value of VR training into education aspects. Now, the sad part here is there's only 15% of that is coming down to healthcare sector. Now, healthcare sector is more than happy to sit back and talk about not having enough evidence, but refusing to look at proven evidence out there across other sectors. And they rather want to reinvent the wheel. So these are challenges which absolutely need to be understood. And we work a lot with evangelists to be able to bring that change management and educate the market on what's actually out there.
Yes, of course, because there is a big avoidance or resistance to technology in healthcare professionals, especially doctors, as I have experience with my colleagues. But maybe Denise can do a little bit of explanation about that.
Yeah, the problem for virtual reality is similar to other areas. It's the question of who should be investing in bringing together all the effort that it would take to renovate or to redo the way that that the physicians operate and bringing in virtual reality. I think of prevention as the same thing. Like, nobody wants to stop the system and bring in prevention. And with virtual reality, it's not even at the level of there's no reason why even the whole NHS should have to invest. This is a worldwide opportunity to diminish as well, we haven't mentioned this, the issues of burnout and mental health problems of the healthcare professionals. This affects every healthcare system in the world. So there would need to be some sort of supra-authority that could take all the data that's there, do a humongous medical economic demonstration of its validity, and say, this is the way we're going to do it. I personally don't believe we would have to update the headsets all the time. You could keep them for as long as possible with certain apps that already work, and that would be one way. I mean, look at, I do believe as well that even that Meta is overlooking an opportunity. It seems like Mark Zuckerberg thinks that someday everybody's going to be walking around wearing headsets all day long and no longer having cell phones. I certainly hope that is never the case. They could be making a fortune just by developing the niche of training and healthcare if they were to look at it as a worldwide opportunity. When one particular clinic has to try to do this on their own and get all the data, do the economics, it doesn't work as well.
Of course, it should be something more globally adopted, more than locally. It makes it much easier to do that if it's coming from the government or from the central healthcare provider system. But to overpass these barriers, how could we get to the final users and make them want to try at least? Because I think VR cannot be explained. You have to try it out. That's why I have the headset here, but you have to at least see what that's like, and then you have to try it. If you don't leave it, you don't really understand how immersive this can be, because you put on the headset and you're really there, and you can train anything, like soft skills, communication skills, which is very important for patient safety at the end of the data. I think maybe Denise could.
Yeah, I think one avenue that hasn't been tried would be, I guess, to get together the headset manufacturers, would certainly be in their interest, and have them propose, this may sound silly to you, but propose demos to all of the medico-economic decision makers in all of the regulatory authorities around the world. Have them try it, have them see the data, and say, what are you waiting for? How can we work together?
Yeah, sorry.
What's your experience in trying to connect with the NHS?
Yeah, I think this is quite a pressing point, particularly a big barrier for the entry. And I guess my 2 words around that would be, first and foremostly, we need to be thinking about innovating not just on the technology, but also the business models. There's so many get-arounds, we need to be able to maneuver ourselves across that. For instance, the way we firsthand witnessed when you're talking to a public sector organization is that there's quite a big difference for them when it comes to CapEx cost versus OpEx cost. It's a very simple thing. In our minds, we would be thinking, okay, it's only a $200, $300 headset, but it's got a great value return. For sure, they're going to be able to pull this off. But you'll be stuck almost for surprisingly a year or more, even if it's a $200, $300 headset. So when you start to think about it, you could actually have a get around to by doing a different package together. Like combine VR, the hardware and the software offered together. So we've launched out i3XR Lab. We've deployed this in Singapore, SingHealth, the Ministry of Health, with the labs. And what it does is we could actually transform any of the underutilized spaces into XR classrooms, whether it's for 5 users or 10 users. You have the AMC taken care, the annual maintenance. They don't have to worry and bother their IT departments to worry about it, and they actually come with the software that they would like to choose for their requirements. And another crucial thing here is localization. So localization have to be right at that framework level so that every organization can localize it to their needs, and it should not be charged. It should be able to be given for free.
Yeah, talking about localization, not only localization, but having a VR simulation is so adaptable to any kind of different protocol, different hospitals, different environments of cultures. And that's another big benefit, I think.
I just wanted to add one more important point. We were talking about platform aspects. So the content itself is completely platform agnostic. Today, these game engines are able to give us complete platform agnostic contents. So the only difference is that if you're using a VR headset, you're going to get a much more immersion. But the point here to note here is, when it comes to training, it's about the learning objective. You could still get the learning objective whether you're accessing through the mobile or a PC or VR. So it is widely available.
Accessible. And I wanted you to talk a little bit about the differences you see between the academic use and the real clinical use case for medical training after they're already in the practice.
Yeah, so about 4 years ago when we started experimenting with this technology, some of the VR apps that we were building cost a lot of money to instruct a VR developer to develop the material, and it would be in the tens of thousands of pounds. But those costs have come right down due to generative AI and things like that. The actual content, in terms of the academic content, you need to make a learning objective needs, so that VR is very good for defined learning objectives. It's not a panacea. It doesn't cover everything, but for defined points, it can work really well. When I was a medical student, I remember learning my OSCEs, which is my clinical examinations, and I would be practicing with a partner, just making up a script. But nowadays, with communication skills training in VR, you can program a virtual avatar to interact using AI and basically have a really immersive, deep conversation that you can touch upon delicate matters like psychiatry or mental health, and you can practice your empathy skills, and as well as those procedural skills which can also be learned in VR as well. But the actual content in terms of, to answer your question, academia and then going down into the clinical settings, it's important that we are developing products that are needed, not that we think they need. So we need to go to the medical students, we need to map it to the curriculum, we need to make sure that we're covering all the bases that we are meant to be covering, and provide content that's valuable.
Great, yeah. Before we go to questions, can you summarize in maybe 1 or 2 words the way you could improve the adoption of VR in clinical training?
The adoption we need to first and foremostly democratize virtual medical simulations, and the only way to do that is to bring in AI integration into it. And what I mean by that, are deep learning into that. So we are creating AI authoring tools so the clinicians themselves be able to, or empower the clinicians to be able to author these simulations on a no-code basis. We've completed the POC of this, and it's already proving to give 80 to 90% of cost and time saving in the development of simulations, and that's the only way we can actually take into the future.
Democratize demos of improved communication skills between professionals and patients.
I would say it's really important that forums like this exist, where there is that bridge between academia, clinicians, industry, and everyone involved, because that's the only way we're going to get the product that is of most value with all of these people combined working together.
Very good. So, does anyone have any questions? I don't know if you have another microphone here.
Great talk. I think every one of you adds one angle to the topic. So let's say as a doctor, if the doctors could tell me one clinical situation that you think that is most feasible, or let's say the most likely one that could be approved or could be started at a hospital, like a very winner situation.
One that springs to mind immediately is something like breaking bad news. So you only have one chance in life when you are speaking with a patient or a patient's relative to get that right, and that patient and their relative will always remember that conversation. So if you are breaking bad news, say such as an oncology patient or a palliative patient or something like that, if you have experienced in VR that scenario and you've learned how to deal with maybe an angry patient, or you can program it into different elements of how you want to play the scenario. But that's where this is kind of gold dust, because you can practice in VR before the real life scenario, and it just makes that interaction even better when you come across it in real life.
From our point of view, we deal predominantly across emergency and trauma and critical care. Anywhere where there's a low frequency, high stakes situations such as pediatric resuscitation, these are definitely life-changing situations where you can build that muscle memory repeatedly in a very safe environment.
You might be surprised to know that there's a lot of work being done during labor. Yeah, improving the situation, because we haven't mentioned it, but wearing the VR headset with an appropriate program gives the idea that time is much shorter. So the patient who is going to give birth could spend hours wearing the headset before, let's say, the very final stage, and feel that it has gone by like this and with much less pain.
Well, thank you very much for everyone. We have very few seconds if you want to have a very short question, or we're going to be done with it. Okay. Thank you very much.
Thank you.
Thank you very much.